Hi, everybody. My name is Helen Ann Lawless. I use she, her pronouns. I'm the Director of Strategic Wellbeing and Training at the Wellbeing Center at Warner Hall, and I'm here with my colleague, Dr. Kelly Frick.
Good afternoon. My name is Dr. Kelly Frick. I am a family medicine physician and a medical director at Student Health Services. I use she, her pronouns, and together we are two of the directors in the wellbeing units here at UD.
And today we're going to be talking about a really popular topic and addressing some frequently asked questions that we get from parents and families and students around the wellbeing fee as well as insurance. Dr. Frick, can you walk us through what the different options for coverage are for students at the University of Delaware when it comes to healthcare?
Sure. So the University of Delaware provides comprehensive well-being coverage for your student through three individual buckets, which we'll talk about. So the first is the well-being fee. So all students are charged a well-being fee, which is part of their student fees. And that well-being fee covers the majority of the services that they'll receive here at UD through the counseling center, through student health services, through health promotion, and a lot of our other peer education programs as well. So again, all of the services at the counseling center, so that's all visits with psychiatry, psychology, counselors, group therapy, virtual services, all the services at the counseling center are covered under the wellbeing fee. For our health promotion department, that's all of our peer education programs, all of our bystander training, all of our alcohol and substance abuse support services, all of our sexual assault support services. All those services are covered under the wellbeing fee. At Student Health Services, most of our services are covered under the wellbeing fee, and we'll talk about that in a later slide in a little bit more detail. On the left-hand side of the screen is where your medical insurance comes into play. So there are some services at the university where medical insurance is used, and we'll talk about those as well. Your student would also be using their medical insurance if they go off campus, so for a specialist visit, to an urgent care, to a hospital system, or if they need any services off campus like an MRI, perhaps an endoscopy, something like that that we don't do on campus. The other side of the slide is referring to prescription coverage. Most students don't know anything about prescription coverage because they've never picked up a prescription by themselves. So it's important to make sure your student knows what their prescription coverage is as well as their health insurance because sometimes they're two separate cards or sometimes they're on the same card. So for prescription insurance, we utilize prescription insurance for prescriptions here at the university. They can also use their prescription card at any of the local retail pharmacies close to campus as well.
So as Dr. Frick was mentioning, there's the student wellbeing fee that is automatically included in all students' fees. And you can see on the slide that we're going to show that every icon on the page represents a service that the student wellbeing area on campus provides. And the icons that have a green check next to it are services that come with no additional out-of-pocket costs, no copay. We don't bill insurance for those services. But then there are a few that you will see where we do bill insurance, or there may be some additional out-of-pocket costs. And Dr. Frick, I'm wondering if you can help us walk through those.
Sure. So just want to highlight before we move on to the services that don't have a green check, let's look at the services that do have a green check and just make sure that we're on the same page with what is covered under the wellbeing fee. So any visit that your student would have with a provider in the wellbeing unit, so that's all physicians, nurse practitioners, nutritionists, psychiatrists, psychologists, counselors, therapists, prevention specialists, all of those visits are covered under the wellbeing fee, which means we do not bill insurance for those visits. Your student will not pay a copay for that visit. And those students can come in and access those services as often as they may need to. The services that do bill insurance for are any services that are provided through a contract with an outside agency or with a third-party biller. So the first one is laboratory services. So any laboratory services that are sent out to LabCorp request. So a reference lab, so that would be something like a thyroid panel, lipid testing. So something that we don't do on site at the lab here at Student Health. This does not include things that we do on site. So things like strep testing, mono testing, urine testing, those tests we all do in-house, and those are covered by the wellbeing fee. For x-rays, so we do have an x-ray suite on site here at Student Health Services, and those x-rays are sent out to an external radiology group for interpretation by the radiologist. So x-rays are billed to insurance just as if you would go to an x-ray provider off campus. All prescription medications, over-the-counter meds, and medical supplies like crutches and splints are also billed through insurance or have an out-of-pocket cost. And then there's also a well-being vending machine on campus, and that provides an opportunity for students to buy over-the-counter and sexual health supplies at a vending machine, and that's out of pocket as well. For our immunization services, so all vaccines and all titers and tuberculosis testing that we do here at UD, those are billed through insurance or out of pocket if your insurance is out of network. Similarly, our travel programs, students that need travel vaccines for study abroad programs or malaria prevention prescription for study abroad programs, those services are billed through their insurance as well.
There's also a health insurance requirement for students at UD in addition to the required well-being fee. Could you share a little bit more about why that is and what's included in that requirement?
Sure. So the university follows the recommendations from the American College Health Association, which is that all students matriculated at the university have comprehensive health insurance. The requirement here at UD is for that plan to be an Affordable Care Act compatible plan, so providing comprehensive coverage for the patient, not just catastrophic coverage. So it covers things like preventative health care, STI screening, immunizations, things that are important for overall health and well-being, mental health services, for example. So all students at UD are required to have health insurance. In the event of your student accessing a service either that we don't provide on campus or perhaps an emergency service, students would need to use health insurance off campus. So we get some questions sometimes about, well, I have the Wellbeing Center on campus, so I don't need health insurance because I'm not going to use anything off campus. And we know for most of our students that even though they do use the wellbeing services on campus, there are services that they need as part of their healthcare that we don't offer on campus. And that's where health insurance comes into play as well. Your health insurance also is portable, right? So it doesn't just cover you when you're here in the state of Delaware or at UD, it covers you wherever you are in the country if you're back home. So together, those things make up a comprehensive approach to well-being for students. It's important that students have a copy of their health insurance card as well as their prescription insurance card, if those are two different things, and that they upload that information to their UD Health portal. That way we'll be able to access that information seamlessly if they do have a service that's billable at UD. They should also have a copy with them, usually on their phone or in their wallet, so that if they need to go to urgent care or to the hospital, that they're able to provide their insurance information on site.
A big question that we usually get from parents and families during this point when we're talking about insurance versus the well-being fee is that what happens if my student's insurance is not in network for services at the Wellbeing Center? How would you respond to a parent who had that question?
Sure. So there's only a couple situations where in-network versus out-of-network insurance comes into play. So again, for all of the services we previously talked about with the green check, so all of the provider visits, that's physicians, nurse practitioners, nutritionists, psychiatry, counseling, psychology, none of that goes through insurance. So it's important to note that UD students can access all well-being services regardless of what their insurance plan is. We know at other schools, sometimes their student health services are only available to students who have the school's health insurance plan. That is not the case at UD. So no matter what health insurance plan a student has, they can access all the services at UD. For the services where we do bill health insurance, if those services that your student is receiving, if your insurance is in network for those services, we will bill your insurance for those services. If your insurance is out of network for those services, your student can still receive those services here at UD. They would pay for that out of pocket and then provide reimbursement receipts for your insurance company for you to resubmit for reimbursement. Or we would provide them with in-network options locally in the area if they wanted to go elsewhere to use their health insurance if they're out of network here. We know there's a lot of questions about insurance, certainly in network, out of network. This is not unique to us here at Wellbeing at UD. This is a nationwide question always. So if you have an individual question, it's really helpful. We can talk on a one-to-one basis via email or phone call, and we can make sure that we get the right answer for you for your family situation.
So you alluded to this when we were talking about in-network versus out-of-network options, that universities across the country often offer a university health insurance plan, and that is also the case at UD. Can you talk about when, more around that UD health insurance plan, and what parents and families and students should know about that.
Sure. So UD offers a student health insurance plan that's brokered by a company called University Health Plans. This year, the student insurance plan is provided by Highmark. It's a comprehensive PPO plan, so it's portable, meaning it doesn't just work for your student while they're here in Delaware. It works across the country. And students have the option of selecting that health insurance plan. The way that UD ensures that all students have health insurance is by automatically enrolling everyone into the UD health insurance plan. If you decide that you do not want your student to have UD's health insurance plan, you have to submit a waiver, essentially to waive the cost of the health insurance plan. The criteria for submitting a waiver are pretty straightforward, but there's a couple of things you want to think about before submitting that waiver. We're going to talk about that in a later slide. But basically, you want to make sure that your student has in-network options in the state of Delaware. If you do decide to keep your own insurance and not continue with the UD student health insurance plan, you'll submit information about your health insurance plan to the waiver portal. And then risk management will ensure that that plan is an ACA compliant plan. Essentially, it's not a travel plan, it's not a catastrophic coverage plan, but that it does have comprehensive coverage. And then you'll see that you'll get a credit on your student's tuition bill for the health insurance premium. So essentially, all students are billed for the health insurance premium. And then once your waiver is received and granted, then you'll see a refund for the health insurance premium on your bill. This information is provided via email to your student. It usually comes out in July, and the waiver is due September 15th each year. If you submit a waiver in the fall, you do not need to submit another waiver in the spring. And more information we'll have available on the slides here for the contact information for more questions about the health insurance plan.
Reiterating what Dr. Frick said, the university health insurance plan is administered outside of the student well-being portfolio. So it's really important that if you have questions about this plan and you're comparing it to your student's current health insurance plan versus the plan that the university offers, please contact the website that you see there or the email that you see listed. And that will also be linked in the Blue Hen Family Hub post that accompanies this video.
So that website has everything from the premium costs to the copay costs to the dates of coverage to options for vision insurance, dental insurance. It's a pretty comprehensive website. So definitely reach out, take a look around there, and also reach out to them directly. They're a specific student insurance plan company. So they work with students and families as 100% of the time. That's their only role.
And so, Dr. Frick, you also shared about this earlier of things to consider when you're looking at, do I keep my student's current health insurance plan or do I go with the university health plan? We know this topic is usually top of mind for out-of-state families. What sort of tips would you give those families when they're considering that question?
Sure. So out-of-state families, there's nothing, the unique part about out-of-state families is that the students likely don't have access to their historical healthcare providers because they're further away. So if you're out of state, and if you're thinking of keeping your own health insurance plan and not using UD's health insurance plan, you want to make sure that your student has in-network options in the state of Delaware. So what you'd be looking for is urgent cares, emergency departments, hospital facilities, specialists, things like orthopedics, cardiology, neurology, dermatology, as well as imaging centers, MRI facilities, CAT scan facilities for your student. If you don't have in-network options, the other thing you could look at is asking your insurance provider for an away from home status. So away from home status is a service that some insurance companies will offer, where you can contact them and provide verification that your student is going to be enrolled at the University of Delaware. And then some insurance plans will open up in-network options for your student while they are in Delaware. So during the time that they are here at UD, their in-network options would be here in Delaware. And then when they are at home, their in-network options would transfer back to home. Not all insurance programs offer that option. So it's important to connect with your insurance planner directly to see if that's an option for your student. So again, if you don't have in-network options in the state of Delaware, or if your away from home status is not an option for your student, you'd really want to consider the UD health insurance plan in those scenarios.
All right, so we talked about a lot today, and as we were talking about earlier, we know that health insurance and navigating healthcare systems is a really complex topic. That's true not just here, but all across the country. But we are here to help, and so are our colleagues at University Health Plans. So please don't hesitate to reach out to us with the contact information that you see on the slide. And we feel free to comment on the posts in the Bluehead and Family Hub, and we can connect with you that way as well. So thank you again, and stay tuned for more health and wellbeing tips from Student Wellbeing.